Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon to all of you. We are here in Focus Point Road Show. So as I mentioned before, we have a very good and very interesting session. As for now, I'll bring the Dr. Nicholas Go. So maybe a little bit, Dr. Nicholas Go, a consultant ophthalmologist and eye surgeon from Isaac. And Dr. Nicholas is graduated from International Medical University from International MBBS degree in 2011. And Dr. Nicholas completed his training in ophthalmology from University Malaya in 2021. He was gazetted as an eye specialist by the Ministry of Health of Malaysia and is registered under the National Specialist Register of Malaysia. He had previously participated in numerous cataract camps in Malaysia, and of course, he served in the ophthalmology department of Hospital Klang, Hospital Kuala Lumpur, Selayang, Sungai Buloh, Hospital Shah Alam, Hospital Ampang, and also Hospital Temerloh. So with the topic, common eye problems in a child, please welcome Dr. Nicholas Go.
Hi everyone.
Dr. Nicholas here. I thought you are here.
Oh yeah.
Hi, Dr. Nicholas. How are you?
Nice to meet you.
Have a seat.
Excited to be here today. Yeah.
I thought Nicholas is over there.
Yeah.
So, Dr. Nicholas, so far, maybe a little bit of you. Okay? They said you graduated in 2025 or 21. Sorry, 21. So maybe you can share with us your journey to become the ophthalmology. Maybe just a little bit one.
Actually, I developed this passion for ophthalmology since medical student time when I was in IMU. Yeah.
Okay.
So I had a very passionate teacher who actually influenced us well to delve further into the area of ophthalmology. So initially, we didn't have much exposure, but fortunately, our local training master program allows us to sub-specialize further into this degree, and therefore, I managed to pursue my dream and become an ophthalmologist. Yeah.
So previously, you was a teacher? No.
No. Because we all started as a medical student from the beginning.
Okay.
Yeah. And from there, we will receive further training to become a house officer, medical officer. And then pursue our dream to become a specialist.
Okay. So we straight to the point with our topic of the day, common eye problems in a child. So maybe you have something to share with the audience.
Okay. First of all, I would like to thank Focus Point for inviting me here today for this grand opportunity to give you all a talk. So today I'll be delivering an exciting talk on common eye problems in a child. Okay. So the contents of my presentation will be on common eye conditions such as lazy eyes, refractive errors, squint, eyelid condition, as well as red eyes, and certain important conditions that not to be missed in children. Okay, so first I will begin with a lazy eye. So this is a picture of a child with an eye patch over the glasses, which is a patch therapy for lazy eyes. So medically, lazy eyes is termed as amblyopia. It is a quite common condition, affects 1 in 50 children. So it's actually defined as a good potential to see eyes, but the eye is unfortunately having a poor vision. This is commonly caused by... Okay, this is commonly caused by disturbances during the visual development during the first 8 years of life, which is critical for their visual maturity. So any disturbances will relate to the abnormal link between the brain and the eye and causes a defect at the visual center. So with this defect, it will lead to poor vision, and if untreated, this poor vision will persist into adulthood. Yeah.
Okay.
So lazy eye is actually an endpoint for many other eye diseases. So it can affect one eye or both sides. And there are several causes of lazy eye. It could be diseases that prohibits clear vision, like cataract, cornea scar, or eyelid drooping that covers the visual axis. So refractive error is another cause of lazy eyes. So high refractive errors will cause blur vision, or unequal refractive errors will also cause poor vision on one eye, and this would ultimately leads to lazy eye. So apart from that, squint is also a well-known cause of lazy eye because our brain would suppress the vision of the deviated eye, and that leads to poor vision on the deviated eye. Yeah. So this is an example of an eye with a cataract. Yeah. So the cataract actually blocks the visual acuity and leads to poor vision of that eye, and subsequently the child will develop a lazy eye. So this is a picture of a child with a droopy eyelid. So the droopy eyelid will cover the visual axis, and eventually over time it may lead to a lazy eye.
So this is the lazy eye.
Correct. So the area which is affected during their development of the visual maturity may present with a lazy eye. Yeah.
Okay, now I know.
So certain severe degree of squints will cause eye deviation and also poor fixation, poor vision, and the deviated eye may be suppressed by the brain and ultimately results in a lazy eye. So if you ask me, actually it's quite difficult to identify a lazy eye. So I give you a question like, how does a lazy eye look like? Yeah. So it can actually present in mild degrees like a normal eye. It can also present in severe degrees like a squint eye. So it's actually quite hard to tell whether a child is having a lazy eye. So if there's any suspicion, any strong family history of myopia or squint or refractive errors, we advise you to go for an eye checkup because it's often quite hard to tell. Yeah?
Okay. Yeah. Okay, sure.
Okay.
How does it? Okay.
So the next part will be what are the symptoms of lazy eye? Yeah. So this will be most of the parents' concern. Yeah. So the young children are often unable to identify that they are having a lazy eye because they are actually born with the kind of condition, and it could be a normal situation to them. Yeah. And most of the time they are too young to even voice it out. Yeah. So we have to take an active role to examine our children. A simple test will be we can cover one eye. To see whether they object the occlusion of one eye. If they object the occlusion of that eye, then most likely they are relying on that eye to see, and they don't like it if you cover that eye. Yeah? So if there's any suspicion, we advise you to bring them to an eye doctor for a complete checkup. Yeah? So if there's a strong family history of squint and a strong family history of refractive error, sometimes your family members might inherit those conditions as well. So it's better to pick them up earlier. And often older children are able to tell whether they have lazy eyes. However, sometimes it may be already too late because they have grown beyond the visual maturity. Yeah.
What is the best age to identify this?
Okay, my next slide would answer your question.
Okay, good.
Yeah. So the best time to treat lazy eye is to treat them early, below 13 years old. So below 13 years old, early treatment, there's a high chance that the condition may totally be reversible. However, beyond that, sometimes the treatment benefit may not be so good. There may be modest improvement, and there may be some residual poor vision beyond 13 years old. Yeah. So the treatment is required to be early, and for lazy eyes, it can be caused by many other conditions. So we might want to treat those conditions first, like a cataract or a high-angle squint. Yeah. So sometimes lazy eyes can be caused just by refractive error. So
there's a lot of possibility, right?
Yeah, a lot of possibility. Yeah. Okay. Sometimes simple intervention like glasses can help to restore good vision for lazy eyes. And sometimes we require to do patching because lazy eyes can be severe. So patching actually is a process whereby we cover the good eye and allow the poorer seeing eye to be trained, to be used more frequent so that their vision is improving. Yeah. So there are many ways to patch. You can apply a colorful sticker onto one eye, or we can even put it above our glasses. And normally adherence is an issue in patching treatment. And therefore, it's important for family members to take part in the activity. Maybe we can create an exciting activity, encourage them, motivate them with some rewards. Yeah. So this would encourage adherence to patching. So if patching doesn't work, there are certain medications that can penalize the good eye to allow the poorer eye to be used more frequent. There are also newer technologies such as dioptric treatment, whereby binocular interaction is actually encouraged during the lazy eye rehabilitation. However, the earlier versions was not very promising because of poor adherence issue. But however, there's a newer version of VR headset that allows immersive experience. Yeah? At the same time, we can do this binocular therapy. This helps to produce better results. Yeah. So from studies, it shows that VR headset can have a better visual improvement compared to glasses, and certain streaming devices that allows one to watch videos with both eyes also have similar effect to patching. So the newer generations of technologies have produced better results compared to the previous traditional methods. Yeah. Okay.
Okay. All right. So very interesting. Lazy eyes. This is my first time actually.
Yeah.
This is my first time. I don't know what is lazy eyes is all about. But thank you so much.
Sure.
So refractive error.
Okay, so the next part of my presentation will be on refractive error. So it is quite a common condition in children. So it is a term used when one requires glasses to see better. So from a local study in 2006, actually 13.4% of our children has some degree of refractive errors. These children aged between 7 to 9 years old. It is more commonly found in Chinese, followed by Indian and Malays. And from preschool studies, the commonest form of refractive errors is myopia, followed by astigmatism, and then long-sightedness. So it was found that among children with refractive errors, 2% are associated with squint. And refractive errors, if they affect their eyesight, it may lead to lazy eyes if untreated. So therefore, we encourage children to have a formal eye screening before they attend school. Yeah. Okay. So
well, quite high the percentage over there. Yeah. 13.9%. So this is based on the research.
Yeah.
So I'm so sorry because the myopia. Maybe some of us didn't know what is actually myopia. What is that?
Okay,
maybe you can elaborate more.
My next,
your next slide.
My subsequent slide will cover
okay.
about the types of refractive errors which are available. So the most common form is myopia. So myopia is the ability to see near but not to see blur well. So it's a very common condition that is genetically linked and it runs in the family. So usually it starts from ages 6 to 13 and the condition may get worse up until 20 years old where the eyes no longer grows. Yeah. So what happens in myopia? Myopia happens is because when the eyeball is too long and therefore the image which was focused lies short in front of the retina. And this condition requires corrective glasses to bring the image on the retina for us to see better. Yeah. So glasses prescription may actually improve myopia. Yeah. The side of myopia. And signs of short-sightedness would include difficulty to read words from a distance, like when they attend school, they have difficulty to read the whiteboard. Or if you see your child is sitting too close to the television or holding their handset too near to their face, yeah? Or when your child complains of frequent headache, rubbing their eyes a lot, so this could be a sign of myopia. So if you encounter any of these, it's advisable to bring your child for eye checkup, yeah? Okay. So there are certain evidences that has shown to actually control the growth of myopia, the short-sightedness. So short-sightedness is actually linked to intense near-work activities and also screen time. Yeah. So it is encouraged to have your child to take regular breaks in between near works. Yeah. Yeah. To relax the eye so that it is less conditioned to developing near vision. Yeah. So there's a 20-20-20 rule which is easy to apply, whereby after 20 minutes, we encourage you to take a short break of 20 seconds, look far away at 20 feet away to relax your eye. Yeah, you can go for a coffee break, go for a toilet break, no issues. Yeah, so that would ensure that your eye is not conditioned to develop myopia. Yeah, so there are new evidence of daily outdoor activities associated with light exposure. So they have shown to increase the production of dopamine that inhibits the growth of our eyeball length. Yeah. So from studies, it shows that it's recommended to have at least 2 hours or more outdoor daily. So this would help to reduce the myopic progression by at least 24%. So far, regarding screen times, several studies have shown inconsistency. Some shown that it doesn't actually help much to control screen time for myopia. But in general, WHO has recommended totally no screen time for children below 2 years old and less than 1 hour of screen time for 2 to 5 years old. And for above 5 years old, there's actually no consensus or guideline. But in general, we would advise patients to limit their screen time of less than 2 hours per day. Yeah.
2 hours per day.
2 hours
per session per day.
Per day.
Wow.
Yeah.
Okay.
Yeah. We would advise you to limit your screen time at home. Yeah.
How about the adults like us? Maybe you can share with us maybe the limit hours. Maybe.
For adults, it's a bit different because adults' eyes might no longer be growing. Yeah. Okay. So it doesn't affect much. All this prevention may not affect the changes much. Yeah. Okay. However, the frequent breaks in between helps. Yeah. It helps to reduce the dry eyes, digital eye strain from prolonged near work with computers. Yeah. So these are the common conditions that happen in adult. Yeah.
Okay. Interesting. Okay.
So my next slide will be other methods to control myopia. So there are newer form of interventions that we can employ to actually retard the growth of myopia. So there are newer form of myopic glasses, such as the MyoSmart by Hoya. It has shown to have efficacy of up to 60% retardation. And there are some contact lenses that are able to reduce the rate of myopia up to 45%, which is known as the Ortho-K lens, whereby a child applies it overnight and takes it out in the morning, and it shows to have 45% reduced in the progression rate of myopia. There are also certain medications which was shown by recent studies to able to retard myopia by 70%. And if you use them in combination, you might actually improve the chances of success. But take note that these treatment forms will not reverse myopia. It will not stop the myopia, but it slows down the myopia. Yeah? Okay. Right. And from recent studies, we show that the more severe their myopia, they are bound to get complications in the future that can be sight-threatening, such as glaucoma, cataract, retinal detachment, and myopic maculopathy. So the risk increase multiple fold if their power increases, the more their power increases. So there's actually a significant role to actually prevent, to reduce the progression of myopia, to prevent all these conditions, to reduce the risk of developing these conditions. Yeah.
Okay, cool.
Okay.
So maybe, sorry sir. So maybe if let's say you have any questions, maybe towards the end, okay, I will open the floor to you guys, okay?
So the next part of the refractive error will be on astigmatism. So it's a very common condition. Most of the child have some degree of astigmatism, but they might not require glasses because it's low astigmatism. So it commonly mixed with other kind of refractive errors like short-sightedness or long-sightedness, and it's commonly due to the surface of the uneven cornea. Yeah. So a normal eye has a round spherical surface which has a regular plane, but in patients with astigmatism, they might have an elongated eyeball whereby it develops two planes, which is a flat plane and a steep meridian that creates multiple focal points and therefore results in a blur vision in patients with astigmatism. Yeah. Okay. So the symptoms of astigmatism would be like blur vision, headache, tired eyes, and sometimes the child may adopt abnormal face turning in order to see better when they are looking at the distance. So usually astigmatism is a mild condition, but if let's say it affects their vision or they adopt any abnormal face turning, they might require glasses. Yeah. Okay. Okay. So after astigmatism is the long-sightedness. Yeah. Long-sightedness is medically termed as hypermetropia. So actually, many child has these conditions since birth. And normally it gets better when they reach 3 to 6 years old because the power will actually neutralize. And if it persists, it's generally due to genetic inheritance. So it's caused by a condition whereby the eyeball is too short, yeah, and the image that was seen is actually projected behind the retina. And in order to correct this, we need corrective glasses to bring the image onto the retina. Yeah.
So means they have to put on the glasses.
Yeah. They have to. If their power is too high, they require glasses. Yeah.
Okay.
So the effects if they do not wear glasses is sometimes they might have difficulty to see near objects. They might not be able to see the words or pictures clearly in their book. And they can see better if they bring it further away. These are one of the characteristics of long-sightedness. And they get tired easily from works like reading, playing with computers, and they complain of frequent headache. So they might lose interest in studying, in learning. So this is detrimental to their learning development. Yeah. Okay. Okay. So long-sightedness is also associated with convergent squint if the power is very high. Yeah. So for children, they most of the time they require optical correction. Yeah. So in a summary, please bring your child for eye checkup if there's any signs of tiredness, frequent headaches, any complaints of blur vision, and if there's any strong family history of refractive error or squint. Yeah. Okay. Okay. So I'll move on to the next topic. Yeah.
Squint.
Yeah. So I'll be covering a bit about squint. Yeah. So this is a picture of a child with a squint, more prominent on the right eye. Yeah. Or the right lateral gaze. Yeah. Okay, so squint is actually defined as misaligned eyes, whereby the eye muscles are uncoordinated and they do not move together. And the squint can be classified based on the direction of the deviation. It could be outwards, inwards, upwards, or downwards. Yeah, so there are special medical terms for it. Yeah. Okay. So screen can be intermittent, whereby it may not appear throughout the day. Sometimes the child has a good control. Like for example, the picture on the right, the child has straight eyes when they see near, but when they see far, sometimes it will break down into a squint. Yeah. Okay. So there are also squints that can alternate, can affect both eyes. Yeah. So this is a condition whereby the angle is too large and our brain actually suppresses the deviated eye. So the eye is at a relaxed position. So they're actually using one eye at one time, but both eyes are able to focus. Yeah. So this alternating squint. Yeah. So there's also a type of squint that is caused by refractive error, whereby a simple glasses would actually restore the deviation to a normal, to the normal alignment. Yeah. Okay. So causes of squint could be primary or secondary. So primary cause, actually there's no identifiable cause, and the child actually are born with the squint. Yeah. So for secondary causes, sometimes it can be due to a problem in the brain, like a neurological disease, or it could be due to injury along the socket, yeah, or could be due to certain systemic illness. Yeah. Yeah. So what are the signs of squint that you can see in your child? So you will suspect a squint if the eyes are not aligned, or when they start to adopt abnormal head posture, whereby they might turn their head to one corner so that they can use both of their eyes to see better. Yeah, yeah. So let me ask you a few questions about a myth of in ophthalmology. Yeah. So the first myth that I would like to bring out is about whether a squint treatment, is it only a cosmetic treatment? Anyone knows the answer? Yeah. Okay.
Is it?
Okay.
Is it a squint treatment only a cosmetic treatment? No.
Okay.
Okay. No. They said no.
So you're right. Yeah. So the answer is no, because during the squint treatment process, we are actually screening for other conditions that can result in the squint, like an eye cancer, retinoblastoma, which is life-threatening, sight-threatening. Yeah. And squint normally coexists with lazy eyes. So apart from the squint treatment, they might need to go for some visual rehabilitation for the lazy eyes. Yeah. And when we restore the squint, we are actually restoring their 3D vision as well. So there are actually benefits of treating the squint early. And actually, squint also affects their emotional development, their self-esteem, their psychosocial development. Yeah. So we are treating them psychosocially as well. Yeah. So it actually affects their confidence, their opportunities in life, their career selection, and even their career advancement in the future. So it's actually a good form of investment to treat their squint early. Yeah.
So it's not just only a cosmetic treatment. So it's not a totally cosmetic treatment.
You're right. Yeah.
It's very good because for the psychosocial development, right?
Correct.
And for the self-esteem, it's very good. Yeah.
Precisely. Yeah.
Yeah.
Okay. So the next question would be: can squint only be corrected through surgery? Yeah, I believe the answer is quite obvious, right? So the answer is no. Yeah. So there are actually various forms of squint. Some can be treated easily with glasses, and then the factors that determining the treatment will be the duration, whereby the onset of the squint occurs. Yeah? Some require, if you can treat before 2 years old, you can retain their 3D vision. And some squint are associated with lazy eyes, and therefore you might need to treat the lazy eye first before you go for squint surgery. And there are also milder squints that can improve with eye exercises, such as pencil push-ups, whereby we focus on the pencil and bring it nearer, or Brock string, whereby we focus at beads at different distances to enhance the convergence strength. Yeah, and so also
the exercises.
Yeah. So okay. They have to focus at the beats at different distances so that their convergence, where the eye turn inwards, is stronger. Yeah, you can train them to be stronger. So the squint manifestation is reduced. Yeah, and also for cosmetic reasons, we can also do a squint treatment. Okay. So the third question will be: is there such thing as a false squint? Yeah, is there such thing as false squint? Actually, there is a condition known as pseudo squint. Yeah. So it's normally due to misleading eye structures that makes the child present like a squint. Yeah. So sometimes they may have a thick fold near the eye that cover the white part of the eye, known as the epicanthal fold. So the eye may look turning inwards. And there are certain conditions whereby the pupillary distance is wider or shorter, and this would also cause a false impression of squint. Yeah. Also, there are conditions whereby their fixation point is actually wider or positive or negative, the angle kappa. So this would produce a different form of squint. So it's important to refer your child to an ophthalmologist so that we can do a proper thorough assessment to rule out all these false negative as well as life-threatening conditions like cancer. Yeah. Okay. So without further ado, I'll continue with the next slide, which is the eyelid conditions. Yeah. So common eyelid conditions in children is like eyelid infection. So 80% of the time it affects children, and most of the time it's due to bacterial cause. So the organisms comes from our skin, staphylococci and streptococci, and the common signs of eye infection would be like lid swelling, redness, droopy eyelid, painful. They may become systemically unwell with fever as well if it's serious. Yeah. So on the picture on the left shows that the eye is having a swollen lower lid with sticky yellow discharge. Yeah. Okay. So normally we treat eyelid infection with topical steroids, and maybe we might commence some oral topical antibiotics, and might commence some systemic antibiotics. Yeah. It is important to refer this kind of child to us early because in children, their natural defense barrier is not really formed. So we're talking about this orbital septum, which is located at the lid. Yeah. So this septum actually prevents the spread of the disease from the eyelid into the orbit in adult patients. But in children below 6 years old, it's not fully formed, and therefore there's a high risk of progression to orbital cellulitis. Yeah. So if let's say it occurs, the eyelid will be extremely swollen. The eye tissues will be swollen as well, known as chemosis. The eye movement may be reduced. The vision may also be impaired. Yeah. So this is actually a blinding and life-threatening condition. So this condition requires hospital admission, requires co-management with the ENT team and the pediatrician. They might need systemic antibiotics, and also some orbital scans would help. Yeah, to look at the other complications. Yeah. So another common eyelid condition is droopy eyelid. So it can affect one eye or both eyes. It can be due to the child born with underdeveloped muscles, or it can be caused by other causes like an eyelid tumor. Yeah. So most of the time they present with an eyelid covering one eye, or can be both eyes. And also they might adopt an abnormal head position, which is the chin-up position, to see better because the eyelid is covering the upper part of their eye. Yeah. Okay. So if the eyelid drooping is very bad, it may cover the visual axis and may lead to lazy eye. Yeah. So this condition may actually worsen from time to time, and therefore it's required to refer to an ophthalmologist for an eye monitoring and also to exclude other conditions that lead to this droopy eyelid. Yeah. So we generally treat when it is cosmetically poor, unacceptable, when the child starts to have a risk of getting lazy eyes, when the astigmatism is too great and too imbalanced, and when the child starts to adopt any abnormal head posture. So we can consider early treatment. Okay. So another common condition in eyelids is tear duct obstruction. So it is also known as congenital nasolacrimal duct obstruction. It's quite a common condition. It's due to the delayed perforation of a membrane that happens in this location. So within our tear duct near the valve of Hessner, there might be a membrane which sometimes perforate at later stages. So this results in watery, sticky yellow eyes. So it's quite a common condition. It can affect both eyes. It can also affect one eye. So they normally presents with watery, sticky eyes, but their conjunctiva is still white. But the good part of it is most of it resolves within 1 year. 90% would have recovery within 1 year. But the 10% that persists, we would encourage them to do some eyelid massage. So how we do this is we use our index finger to apply pressure at the nasal corner of our eye, and at the same time we combine with a downward stroke. So this stroke, we encourage you to do like 5 strokes per day, 5 strokes 3 times per day. So this would help to stretch the membrane to tear it out. So that your tear duct is open. So if there's any eye discharges around your eye, it's encouraged to clean them as well to prevent eye infection. So antibiotics will only be given if there's any sign of eye infection. So the good part is most of it will resolve by 1 year. However, if the condition persists, we can also opt for surgical intervention. Okay. So the final part will be on red eye. So red eye is actually a very common condition among children. The causes would be like infection, allergy, injury, and tumor. So the role to refer early is because you want to identify whether is it infection and limit the spread among the school children as also your loved ones. So conjunctivitis can happen very early in babies as well. So within the first month of life is known as ophthalmia neonatorum, and this is because of certain eye infections that was passed on during the birth from the birth canal. So these organisms can be quite virulent, so it can be potentially sight-threatening. It may cause systemic complication, and the baby is very young with a weaker immune system. Yeah, so most of the time this condition is managed in the hospital with a pediatrician. So they may need to start systemic antibiotics, and on our part we will start some topical antibiotics. And most often we will take an eye swab to determine the type of organisms involved. Yeah. So in older children, viral conjunctivitis is the commonest cause of red eye. So they present with red, watery, swollen eyes most of the time. And the most commonest virus involved would be adenovirus. So this is an extremely contagious condition, but however it's self-limiting. So normally recovers within 2 to 3 weeks. Yeah. So for mild conditions, generally no treatment required. If you want to have some relief, maybe some lubricants would help. Yeah. Some artificial tears. Yeah. But in severe conditions, sometimes doctors may start antibiotics or steroid. Yeah, antibiotics is to prevent secondary bacterial infection, and some steroid will help to relieve their symptoms. Okay, so bacterial conjunctivitis is less common compared to viral. They generally present with red, sticky, yellowish discharge. Yeah, and common bacteria involved would be streptococci, staphylococci, which is our skin organisms. So they are generally treated with antibiotics, and we try to avoid steroid among these patients because it may worsen their condition. But again, it is also self-limiting. Yeah. So another common condition of red eyes would be allergic conditions. Allergic conditions are often associated with other allergic diseases like asthma, hay fever, eczema, allergic rhinitis. They present with red, watery, itchy eyes. Their main complaint is very itchy. Yeah, so it's actually because of hypersensitivity reaction. They are very sensitive to certain substances such as animal fur, pollen, food, or certain medications, which is known as allergens. Yeah, so that they may trigger this reaction. So parents need to have a proper counseling about how to identify the allergens and what substances to avoid to prevent the trigger of this allergic conjunctivitis, because it is a lifelong thing. So it has a lifelong impact. Yeah. So if let's say there's a strong association with other systemic allergies, it's advisable to do a special test like a skin prick test or patch test to identify the type of allergens you are sensitive to. Yeah. So we normally refer to the ENT team or the dermatology perhaps. Yeah. So for treatment of allergic conjunctivitis, basically we'll treat with antihistamines, to reduce the itchiness, mast cell stabilizers to control the disease progress, as well as artificial tears to provide soothing relief of the condition. Some steroid also would help to reduce the acute flare of the allergic conjunctivitis. But if let's say the condition is very severe and prolonged, we might want to use steroid-sparing agents such as cyclosporine. Yeah? So in general, the patient care for conjunctivitis would be, number one, to refrain from touching your eye, because the most common source of transmission is through contact of contaminated source. Yeah. So before and after applying medications, we would advise you to wash your hands regularly with soap, and do not share towels, pillows, and linens among your family members, because it might encourage spread among your family members. And you can apply lubricant to help to ease the symptoms. You can put them in the fridge for the cooling effect. Yeah, so the cooling effect help to relieve the inflammation. So it's advisable to minimize contact with your colleagues, with your friends during the onset of the conjunctivitis. So we advise you to take MC for probably a week or two. Yeah, avoid from going to school or at work while it's contagious. Yeah. So if you are a heavy contact lens user, we advise you to stop using contact lens during the period of infection, up to at least 2 weeks after the infection, to prevent any corneal infection. Yeah. Okay, so I will touch briefly on certain important conditions that are not to be missed in children, such as a whitish pupil. Yeah. So in this picture, you can see that the child is having a whitish pupil on the left eye, as opposed to a red pupil on the right eye. Yeah. So the whitish pupil is actually our pupillary reflex. Yeah, from the inside of the eye. So in medical term, it's known as leukocoria. So why you do not want to miss this condition is that they may be associated with primary eye malignancy, eye cancer in children, that can be life-threatening, can be sight-threatening, and there are other causes that can be sight-threatening as well. So you want them to have an early eye checkup with a doctor so that we can pick up and treat all these diseases earlier so that they have a better outcome. Yeah? Okay. So, yeah. So the last part of my presentation will be on cloudy cornea. So cornea is actually the front part of the eye, which is the transparent structure. So in a clear cornea, it allows you to see our iris and the pupil well. But if the cornea starts to become cloudy, and there's some opacification, it may also result in poor vision. Yeah. So because that it affects the vision early, so we advise you to refer them early for an eye checkup. There are certain conditions that we want to treat early, such as congenital glaucoma, that can be blinding if the condition progresses, eye infection, yeah, before it spreads into the eye, and there are certain metabolic disorders that can be associated with lung conditions or heart conditions. They come along with some eye cloudiness. It can be fatal if they are picked up late. Yeah, so we want to treat them early. Yeah, so in general, our take-home message would be to get an eye examination early if there's any doubt. So if there's any visual disturbances, you can visit the nearest optometrist. They will help to screen your children's eyesight as well. But if there's any severe conditions such as eye infection or cloudy cornea or whitish pupil, please see an eye doctor to get a thorough eye examination. Yeah. So thank you. Thanks again. Yeah. For this.
Thank you so much, Dr. Nicholas. Okay. Half an hour, tak cukup. There's not enough, right? There's not enough because there's plenty of infos. We have, I think you already shared seven common problems. So if let's say you have any problems or any questions you want to ask Dr. Nicholas, maybe after this you can meet in person, maybe after this, okay? Because we have running out of time. And thank you so much, Dr. Nicholas.
Thank you
so much for coming. Thank you so much for your very good and very interesting session here. So maybe we can meet again someday.
Sure.
All right, thank you. Thank you so much. So ladies and gentlemen, a big round of applause to Mr. Dr. Nicholas. Thank you.